Hi, I'm Chanel. Members of the Royal College of Nursing took to the streets yesterday calling for better pay and more staff. You can listen to all the interviews I did here.
Mary-Ann Parkinson, Senior Regional Officer, North West Region.
Right now we've got quite a few members out today. Are you happy with the turnout?
I am happy with the turnout, but must say that a lot of people have said they're unfortunately not allowed to come out because they're busy in work, so they're short-staffed. So people are coming out and standing with us now, but they've got to go back in for clinics at 10, and then people are joining us midway around. But yeah, very happy. Those who can have.
And do you think that this is going to send the right message, the message that you want to send?
I think it's going to get a message out. Whether it lands right with the people we need it to, who knows? But it's what the membership want to do. What they're saying is look, the public, you need to back us on this. We want to retain and recruit nurses, healthcare assistants, and we're not able to do it at the moment on the current pay terms and conditions that we have. So yeah, I do hope. I'm hopeful.
What are some of the struggles, or what are some of the things that nurses are sharing with you?
The struggles are work-life balance, physical work-life balance, children as in nurseries, placements, cars, as you have, buying a car, running a car, rent, housing, just everything you would constantly need as a human being, they are struggling with.
And recently we also reported that some nurses were actually approaching the food bank for help. When you hear something like that, what goes through your mind?
It's extremely surprising that people are having to go to a food bank, but yeah, you're right. One in four of our nurses and nursing assistants are going to a food bank, and they're not going just daily. They're going weekly. They're going daily. They're literally hand to mouth. They've done bits and bats of sharing between themselves, but yeah, it's scary. It's really scary because they're having to make some significant choices, but they're also working up and above the working week just to make ends meet. So they're sharing childcare with each other. People are picking people up. The bulk people who can afford it are bulk baking and bulk cooking and then sharing it out. So yeah, sad, very sad.
And historically, you wouldn't have heard of situations like that.
I've been coming to the island since 2016, and I have never ever known it like this, ever.
So you say the situation is quite bad here?
I think it's crisis, and it's not the lower paid workers. We've got senior nurses who've got mortgages and other commitments that they can't afford to keep.
Right now, aside from today, a week from now, we also have strike. Tell me about that.
So we've got strike planned for next Tuesday. We've got a meeting today to talk about the derogations, as in what is going to be what we call the life preserving services that we're going to derogate. So we're going to come to an agreement with the trust, with Teresa, Oliver, Paul Moore, who's currently on leave, so we're doing it with two of the deputies in respect of derogation. So hopefully it's going to be a safe and a well publicised event. We're happy for anybody to come and join us at any time, but we need the government to stand up. Hence today is going past Timwall, hoping that they're going to come out and listen.
Do you feel as though they're budging?
I think they're seriously considering what their options and opportunities are. Whether they're budging, I'm not sure. I can't say that. That's something you'd have to ask them.
And what's worst case scenario? What happens after, well, not from today, but what happens after next week?
Well, we've got the continued mandate, so depending on what happens after next week, we would hope that Manx Care, along with Manx Industrial Relations, would call us to some form of meeting to establish what point we're at and whether there is any avenues or scope to move in any direction. If not, the mandate from the membership is that we'll continue with this activity. That will impact on the public. The public have got to understand appointments are going to be cancelled, operations are going to be cancelled, follow-ups, it's all going to stop. And that's the only way that we wanted to get the public to understand where we're going, is doing the protest march. We're going to stop traffic. We know it's going to upset the public, but we've got to do something at some point, and this is what the membership asked.
How do you think patients would feel seeing the healthcare staff out, seeing what's happening?
I think they'll be mixed. There'll be some that will be very much in support of us, but I think there'll be some that are angry because we've had COVID, so there's a lot of people that haven't had restoration of services, waiting for hip replacements, waiting for procedures, follow-up appointments. So we're going to get a 50-50 mix. All we're saying is that we're doing this for you. This isn't just about pay, this is about safe staffing.
My last question, I spoke to one of the nurses and she said that nurses are feeling demoralized, among other things. Hearing a word like that, that's not an easy word to digest.
No, they're very demoralised. They're very upset that the government doesn't seem to value them as a profession, because they see health and social care as the last people to get whatever money's left within the pot. That's their perception and their lived reality. So yeah, it's disheartening, because they want to come into work, they want to provide safe and effective care, and unfortunately the current skill mixing and the staffing, they can't.
Anything else you want to add or say?
No, I just hope that the public do get behind us. Come down, get behind us.
Pebbles Madrill.
And what's your role in Unite?
I am a shop steward, staff side rep within Unite the Union.
Now, why did Unite come out to support the RCN today?
As a member of Unite, I'm also under Manx Pay Terms and Conditions. I'm a community dental nurse in Old Nobles Hospital. So obviously the pay awards affect me and everyone that I represent in CCHC.
Are you happy with the turnout that we've had?
It's brilliant, really good. I mean, it's really hard because everybody's short-staffed, everybody. I've taken annual leave for today, to be fair, so that I could support everybody that I work with and work for. So it is a really good turnout, really positive as well, yes.
How important is it for this union's pleas to be heard?
Well, we have to be heard. We are so short-staffed, and the cost of living, the rate of inflation, it's really, really hard for people to live in this day and age on the island.
Being in the profession yourself, what are some of the struggles that you've seen in your own, maybe in your daily life?
I mean, short-staffed is hard. Mental health issues caused by staff being under stress, and it's really stressful working environment when you're short-staffed and can't provide always the cover that's needed. People are having to do overtime, and then it's very difficult to get your time back in lieu. So yeah, it's very hard.
Anything else you want to add or say?
No, I'm just really pleased to support today. I'm so glad I've turned out today. I can only walk a little bit because I've had an operation on my ankle, but I just chose to come and support everybody here.
Hi, my name's Denise Kelly. I'm the chair of the RCN National Trade Union Committee, and I'm here to show solidarity to our members from the Isle of Man here today. The staff here are overworked, they're underpaid, they feel undervalued and underappreciated for the hard work and the safety critical care that they deliver each and every day. This cannot continue. They need to get fair pay to remunerate them and to reflect the safety critical nature of the role and job that they do, and by extension that affects safe and effective care that our patients get. So I would say to the Manx Care and to the government to listen to the voice of nursing and to the voice of patients. Get back round the negotiating table and offer them the fair pay rise that they deserve if you want to be able to recruit and retain people to work on this island.
Do you think the message will be taken clearly now?
We will make sure that they hear the voice of nursing loud and clear. They have to. These members are worth it. You can see the strength of feeling here today.
Yeah, my name's Claire Green. I'm a ward sister up at Nobles, and I'm also secretary of the Isle of Man branch of the Royal College of Nursing.
Now, today we've had a peaceful demonstration by the RCN. Can you tell me about that?
Yeah, we're demonstrating today for fair pay for nurses and patient safety. For me, the most important is the patient safety. Our nurses are exhausted through short staffing, and our patients deserve better than to be looked after by exhausted nurses.
Are we seeing the effects of that in the ward?
Absolutely. Recruitment has been a problem for years on the island. Staff sicknesses are going up and mental health issues are prevalent in the nursing community. Depression in nurses is readily documented at being twice that of the national average.
Are we seeing it increase more now?
I think so. I've seen it on the unit that I work on.
And speaking to some of the nurses, what's the feeling like on the ground?
Just that they're exhausted. I'm constantly having to ring my staff to see if they can come in and do extra shifts or stay extra hours. Those hours often don't get paid, and that's unfair.
Do you think government, the Department of Health and Manx Care will take your message seriously now that they've seen the lengths that you're going to?
I can only hope so. We really want, if possible, to avoid strike action next week, but unfortunately it seems to be the only option left to us.
What do you think, if it has to go to strike action, what do you think would happen?
The plan is that there would be a Christmas Day service, so anybody who needs anything life and limb threatening, emergency service will still open. The wards in the hospital will operate as usual, but there won't be any outpatient clinics or day cases happening.
And you've been sitting outside Tynwald. Has anyone come out yet and given their support or said anything to you yet?
Yeah, also on the way down, when we came down in the car, there were lots of people honking their horns at the marchers on their way down, and one of the members has already been out and said, yeah, thank you for coming today.
And you're also going to be speaking to Tynwald today, or hoping to speak to Tynwald. What's the message you want to get across?
I think the general message is that the staff we've got now are exhausted and we're not providing the best care that we could if we had enough staff.
So my name is Leslie Fields. I used to be a nurse at Nobles, but I left in 2013 due to dangerous working conditions.
Can you tell us a little bit more about that?
Drastically understaffed. Staff were tired, exhausted, not getting their breaks, not even getting to the bathroom, always doing extra hours, not getting paid for those extra hours, and just generally not being able to do our job properly for our patients, and weren't able to look after our patients properly because there just wasn't enough members of staff, and somebody was always off sick or something was always wrong with them. The sickness was awful because we were just overworked.
So then you chose to leave for your own mental health, if I can ask.
Yeah, definitely. I did try to move to a different department to see if it would make it any easier, but wasn't able to. I already had health problems, and I just decided that for my own health, mental health and physical health, that it would be better for me to leave Nobles and get work elsewhere.
Are you still in the same sector or field?
Unfortunately, I'm not. I'm actually medically retired due to medical negligence as a result of Nobles Hospital.
So what made you come out today to show your support?
As I said, I've got ill health. I have witnessed being a patient lying in a bed. I see what goes on in the hospital from that point of view. I've also been a nurse and worked there. I even worked as a deputy ward manager for Secomment, so I know exactly from 2 points of view what it's like to be in Nobles Hospital, and it is very scary. And so I want to be able to make Manx people realise, especially Manx Care, because they're the ones that can make a difference. I want them to realise what their staff are actually going through every day, what it's like to be a patient and a staff member working in Nobles Hospital.
What's your biggest fear?
Something mega there's going to be a really something bad's going to happen. There is already medical negligence, and one of them, I've now got heart failure as a result of them, so I can't work. But there's a lot worse that could happen. Somebody's going to end up dying, or even worse. And they need to stand up and start taking accountability and start looking at their staff and helping them making better working conditions.
So do you think if they do have that extra staffing, it would actually help?
Absolutely. Whenever I actually trained in Belfast as a student nurse. Whenever I was over there, the staffing numbers on a ward were double what they were in Nobles, and that was in 2004, and that was before short staffness. So yes, if they had that extra few members of staff, it would definitely make the difference, and nurses could have a far safer and better job and look after our patients far better.
Is there anything else you'd like to add or say?
Fair pay, because during the COVID outbreak, we were all standing on our doorsteps clapping for nurses because they were the ones that were keeping everybody alive and looking after all these sick people. They gave up their lives to look after us during COVID. What they deserve, a better pay and better working conditions.
Right, now Geraldine, you've also come to show your support to the RCN here. Can you tell me why?
I'm the local negotiating secretary for the NAS UWT Teachers Union, and I've come here in solidarity with our colleagues in other public service unions as they supported us in our dispute as well. We're basically in the same boat in that cost of living, recruitment and retention issues in public service, key worker issues are the same across the board. So I'm here to support them in that.
And teachers are facing the same kind of issues.
Yes, absolutely. Most definitely in relation to pay and cost of living. Those are still major issues for us.
How important is it that we have government listening to the people, because we've had the teachers strike, we've got this, next week we've got a strike with the RC, and all the unions are calling out for help.
We're actually still in dispute, by the way, so you need to be aware of that. It's really important because we keep getting the answer there's no money. However, if we don't have money to run our essential public services, then how is the Isle of Man going to operate? That really is what needs to be faced, and wherever the money has to be found, it needs to be found to run these services efficiently and give people a standard of living where they can remain and live here and work here.
Hi, yes, my name's Debbie and I'm a third year adult student nurse who's due to qualify end of this week.
Oh, exciting. You're here joining the RCN peaceful demonstration. What made you come out?
Well, I think I've been a healthcare provider since 2000 on the island and in different roles, and unfortunately over the years we've seen the demise of investment in nursing, and sadly none of us join the profession for monetary value. The money's never been there. It's a vocation to be able to deliver safe, patient-centred care, and over the last 5-6 years we've not been able to deliver that service, and the nurses today are feeling very devalued, disrespected, demoralised, and we've lost so many experienced nurses because of it. We've also got, last year the government was able to put out staffing levels for Nobles Hospital, and sadly over the 12 months we were hitting the reds of unsafe staffing levels. And obviously this isn't good for patient care. It's not good for the morale of the nurses either. And we're not asking, for an enhanced salary as such. Although many of our nurses now are having to go onto food charity banks. We're getting in more and more debt. We're being asked to deliver more with less. And all we're asking is to make sure that we get the investment on the nursing to be able to recruit and retain, which we're not doing either at the minute because of the terms and conditions. And nurses are compassionate. And we like to do our best for all our patients and their family and loved ones. But now that seems to be so thin that the true point of our joining the nursing profession, and I truly believe that we can do better. Just give us the investment to the service, and I truly believe that the patients deserve best.
Yes, Tracy Bostrom.
And you work here at the hospital?
Yes, I do. It's a normal nurse, a band 5 nurse, but I'm voting today. Well, I'm walking today really to support everybody, support the younger generation. I mean, I'm 60 next year, so I'm getting to the end of my time, but we have to do this. We have to think of the future generation. Unfortunately, new nurses these days, they can't afford their own houses. We are underpaid for when you think what people in Tesco's are paid, which they deserve as well. And other places, we are not getting the same salaries to cope with the cost of living. And something really needs to be done about it, sadly. We all love our jobs. We're all terribly committed. Nobody really wants to do this. If we're honest, we're just trying to do it for fair pay for nurses.
You said you're turning 60 soon, so how many years are you in this job for?
Well, I'll sadly have to work till I'm full pension age, so 67, but most nurses can retire at 60, but depends on the cost of living really, so I will be going till I'm 67.
No, but how long have you been in this occupation?
Oh, I've been doing it since I was 18 years old.
How has it changed since then?
Tremendously. A lot more responsibilities. We are expected to do way beyond what we used to have to do, and pressure on us a lot more. The speed of things, patients are in a much shorter time, so the turnovers are much quicker, and it's also the fact that we can't, we haven't got the staffing now to support it, and this is what we want to do. We want to encourage more people to come into nursing. It's the most wonderful profession anybody could do. We're privileged to do what we do. We love it, but we just are not getting the students that want to come through now. And don't forget, all students now have a degree, at least one degree, and if they're trained in the UK, they've had to have a £30,000 loan to pay that. They've got to pay their university loan off as well. We are qualified people who are constantly training. We have to do our revalidation every 3 years, and we also have to pay every year to be part of, the unions and everything else. So,
why do you think you're not getting the young people? Is it because of all the negativity around what's happening at the moment?
No, I don't think it's the negativity. I think it's purely, sadly, a lot to do with pay, hours. We're working late at night. Very rarely do people go off on time. We're nearly always, nobody will go and leave a patient. I'm sure there are some unfortunate stories out there, but in general, we will work. When we finish our work, most of us have to do training at home online for our jobs, and we also have to make sure that we've done our paperwork. So very often the shift will end, but you will carry on doing your paperwork to make sure everything's handed over to the next people.
Why do you continue to do it?
I love it. I absolutely love it. I love patients. I love working with people, and it is a privileged job. It's a wonderful job if you want to go into it. Don't think it's a negative job at all. It's fantastic.
If you can tell me what a normal day is like for you.
My department, we start at 8 o'clock. We hit the ground running, setting up rooms for the day, and then procedures run throughout. Sometimes lists run over, and we will be very, very lucky if we get our 20-minute break, and then the afternoon lists will start. We have to then make sure we can't leave the department until everything is restocked and ready the next day. Every day, things like the resus trolley has to be checked, and as I say, we're constantly on the go. I do at least 15,000 steps a day on my Fitbit, so...
Thank you for making it to the end of the Little Manx Radio newscast. You are obviously someone with exquisite taste. May I politely suggest you might want to subscribe to this and a wide range of Manx Radio podcasts at your favourite podcast provider, so our best bits will magically appear on your smartphone. Thank you.